If you or your parent stands up, feels lightheaded, and a few seconds later hits the floor, that's not just getting old, it's a warning sign. Some studies cited in clinical reviews suggest that a very large proportion of older adults experience significant, unrecognized drops in blood pressure. Figures as high as 89% appear in the literature when certain populations are studied, and those drops can quietly starve the brain, heart, and kidneys of oxygen. Today, I'll walk you through 14 alarming low blood pressure symptoms seniors must never overlook, starting now. Blood pressure is the delivery system for oxygen and nutrients. Think of the heart and arteries as a delivery truck, and the blood is the cargo it carries. When the pressure falls, the truck slows, deliveries are delayed, and organs that depend on steady supply, the brain, the kidneys, the heart itself, start missing crucial drops of oxygen. Older adults are particularly vulnerable because the body's quick response systems that keep pressure steady are less reliable with age. They may be taking several medications that affect volume or heart rate. They may be frail or dehydrated, or they may have underlying heart or nervous system conditions. There are two important terms to keep in mind. Hypotension means low blood pressure broadly. Orthostatic hypotension is a drop in blood pressure that happens when someone changes position, for example, from lying down to standing. Clinically, orthostatic hypotension is commonly defined as a drop of 20 millimeters in systolic pressure or 10 millimeters in diastolic pressure within 2 to 5 minutes of standing. In plain language, if your loved one goes from sitting or lying to standing and their numbers fall by that size, their brain and body may not be getting what they need during that change. If you're watching because this concerns someone you love, hit subscribe and turn on notifications. We cover crucial elder health alerts. We'll start by naming the first 7 warning signs. For each, I'll say what it looks like, why it happens when blood pressure is low, what makes it a red flag, and what you can do right away. Safe, non-invasive steps that protect the person until professional help is available. 1. Persistent dizziness or lightheadedness on standing. What you'll see: your loved one feels dizzy, unsteady, or like the room is moving when they stand up. It is often brief but may return repeatedly whenever they change position. Why it happens: when blood pressure drops on standing, less blood reaches the brain momentarily. The shortfall of blood and oxygen causes that wobbly feeling. In older adults, the reflexes that normally tighten blood vessels and increase heart rate after standing are blunted. Red flag cues: if the dizziness forces them to stop walking, causes them to grab nearby furniture, or is accompanied by visual dimming, graying out, or fainting, treat it urgently. Recurrent episodes that happen with ordinary activities, rising from bed, standing from a chair, or after a meal, are a warning that this is not a benign, just standing up too fast problem. Immediate actions: have the person sit or lie down immediately. If they're standing, help them to a seated position and then to the floor in a safe way if needed. Elevate their legs if possible. Lying flat or with legs raised helps blood return toward the brain. Encourage slow, calm breathing. Do not leave them alone if they're dizzy and at risk of falling. Note how long the symptom lasts and whether it follows a medication change, a period of diarrheal illness, or heavy sweating. These details are important to tell a clinician. 2. Fainting, syncope. What you'll see: a sudden loss of consciousness, usually brief, with a rapid recovery once the person is horizontal. There may be no warning or a few seconds of warning signs like nausea, sweating, or visual changes. Why it happens: fainting is the brain's last-ditch response to a critical shortfall in blood flow. If cardiac output drops sharply from an arrhythmia, severe valve problem, massive vasodilation, or a dramatic volume loss, the brain can't stay conscious. Red flag cues: any fainting spell in a senior is a red flag. Fainting that causes injury, head strike, hip fracture, or broken bone, fainting during exertion, walking uphill, climbing stairs, or fainting with chest pain, shortness of breath, or a prolonged period of confusion afterward requires immediate emergency evaluation. Immediate actions. If the person is unconscious but breathing normally, place them on their back, open their airway, and call emergency services. If they regain consciousness, keep them lying down for several minutes to prevent recurrence, and do not let them get up quickly. Treat fainting as a medical emergency until a clinician confirms it's due to a benign cause. 3. Blurred, dim, or tunneled vision, gray out. What you'll see. Vision that becomes cloudy, dim, or narrowed, sometimes described as tunnel vision, or everything going gray around the edges. Why it happens. The eyes and the visual centers of the brain are highly sensitive to changes in perfusion. When blood pressure drops, the visual pathways are among the first to signal trouble because they need a steady supply of oxygen. Red flag cues. Vision changes that occur with position change, with fainting, or without clear explanation demand urgent assessment, especially if they are new, recurrent, or occur with other signs like weakness, speech trouble, or facial droop. Immediate actions. Sit or lie the person down immediately. Ask whether the vision returns when they're lying flat. Do not allow them to drive. If visual symptoms resolve but keep happening with position change, document the timing and triggers and report them to the clinician. If visual changes are accompanied by weakness on one side, slurred speech, or confusion, call emergency services for possible stroke evaluation. 4. Confusion, sudden mental fog, or disorientation. What you'll see. A normally alert person becomes forgetful, confused about place or time, or shows slowed thinking. Family members may notice subtle personality changes, or that mom can't follow a conversation she once followed easily. Why it happens. The brain relies on continuous oxygen delivery to support thinking and memory. Lowered blood pressure reduces cerebral perfusion and can create a spectrum from mild fogginess to profound confusion. In older adults with underlying cognitive impairment, even a small drop in perfusion can produce marked changes. Red flag cues. New or worsening confusion, especially when it comes on suddenly, is a medical red flag. If confusion prevents the person from eating, drinking, or caring for themselves safely, or if they're less responsive than usual, seek urgent evaluation. Immediate actions. Sit the person somewhere safe and comfortable. Check for other signs. Are they breathing well? Is their skin pale or cool? Can they speak clearly? Avoid leaving them alone if they are significantly disoriented. Take note of the onset, any medications recently started or changed, recent illnesses, and whether they have had less fluid intake. These details help clinicians triage. 5. Severe unexplained fatigue or lethargy. What you'll see. A notable drop in energy. Seniors who normally get up and move about may become unusually sleepy, spend more time sitting, or nap excessively. They may say they feel wiped out without exertion. Why it happens. When organs are underperfused, cellular energy production falters. The body conserves energy and activity tolerance falls. Low blood pressure that is chronic or episodic can lead to persistent fatigue. Red flag cues. Sudden, marked fatigue that changes the person's baseline function. If they can't manage usual self-care, or the lethargy is paired with dizziness, fainting, confusion, shortness of breath, or reduced urine output, deserves rapid clinical attention. Immediate actions. Encourage rest in a safe position. Assess fluid intake over the past day or two. Dehydration is a common and treatable contributor. If the person has been refusing fluids, having diarrhea, or vomiting, call the clinician. If the fatigue is severe and accompanied by other red flag signs, consider emergency services. 6. Pale, cold, clammy skin. What you'll see. Skin that looks unusually pale, feels cool to the touch, and may be sweaty although the person isn't warm. Hands and feet may be especially cold. Why it happens. The body prioritizes blood flow to vital organs when overall perfusion falls. Blood vessels in the skin constrict, diverting flow to the heart and brain. That protective shunting causes the skin to become pale and cool. Red flag cues. Pale, cool, and clammy skin appearing quickly, especially when paired with rapid, weak pulse or low urine output, suggests circulatory compromise. When this pattern progresses to confusion, decreased responsiveness, or very low blood pressure, it can be a sign of impending shock. Immediate actions. Keep the person lying down, cover them with a light blanket to preserve core temperature, and make sure they are in a safe place where help can reach them. Reassure them gently. Anxiety can make symptoms feel worse. Do not give alcohol or attempt complex home remedies. If these skin changes are sudden and accompanied by weakness, fainting, or reduced urine output, call emergency services. 7. Rapid, weak pulse, the heart's frantic whisper. What you'll see: a fast heartbeat that feels thin and weak when you check the pulse. Sometimes the person reports palpitations or a fluttering chest. Why it happens? When blood pressure drops, the heart often tries to compensate by beating faster to maintain cardiac output. If the pulse is rapid but weak, called a thready pulse, it suggests the heart is working but not generating a strong pressure, which can mean the circulatory system is failing to maintain sufficient flow. Red flag cues. A rapid pulse that is weak and accompanied by dizziness, fainting, chest pain, shortness of breath, or confusion is a red flag. Palpitations that appear for the first time in an older adult or palpitations with syncope deserve urgent evaluation because they can point to arrhythmias or cardiac causes. Immediate actions. If you know how to take a radial pulse, check it. Count beats for 30 seconds and multiply by 2, but also note whether the beats are regular or irregular and whether they feel strong or weak. Have the person sit or lie down immediately. If they experience chest pain, severe shortness of breath, loss of consciousness, or prolonged palpitations, seek emergency care. A short caregiver demonstration, safe at-home checks you can do. Before we keep going, a quick practical moment. 2 simple assessments you can do at home that often give useful clues. First, checking the pulse. Use the pads of your index and middle finger and press gently on the inside of the wrist just below the base of the thumb. Don't use your thumb, it has its own pulse. Count beats for 30 seconds and double that number for beats per minute, or count a full minute if the rhythm feels irregular. Note whether the pulse is fast, slow, regular, or irregular, and whether it feels strong or weak. Record the number and any associated symptoms, dizziness, sweating, chest pain, and tell the clinician. Second, the capillary refill test. Press the tip of a finger until it blanches, goes white, for a couple of seconds. Then release and time how long it takes for color to return. Normally, it refills in under 2 seconds. If refill is delayed, consistently longer than 2 seconds, it suggests reduced peripheral perfusion. This is a quick screen. It's not diagnostic, but it's a red flag when paired with other symptoms like cool, pale hands and decreased urine output. Neither test replaces a blood pressure measurement, which remains essential when available. If you have a home cuff and know how to use it, measure blood pressure lying down and then after standing for 2 to 5 minutes to check for orthostatic changes. If you don't have a cuff, these basic checks still give you valuable information to report. We've covered the first 7 symptoms, the early and subtle signs your brain and circulation may be struggling. These are the changes family members often notice first: dizziness on standing, fainting, vision dimming, confusion, severe fatigue, pale, clammy skin, and a rapid but weak pulse. Each one on its own can be significant. Together, they demand attention rather than consolation. Before we move on to the remaining signs, which include gastrointestinal clues like nausea, more obvious cardiac warnings, peripheral discoloration, and the clear picture of shock, it's important to tie what we've already described to the most common causes seen in older adults. Understanding the typical culprits helps caregivers know which details to look for and communicate to clinicians. Why seniors are at higher risk and what commonly causes these symptoms. Several age-related factors make hypotension more dangerous and more likely to be missed in older adults. Dehydration and reduced fluid reserves. Older adults have a decreased thirst response, and illnesses that cause nausea, vomiting, or diarrhea rapidly reduce circulating volume. Reduced oral intake and diuretics used for heart failure or hypertension can compound this risk. Polypharmacy and medication effects. Many commonly prescribed medications for seniors, diuretics, certain blood pressure drugs, some antidepressants, and medications that affect autonomic function can lower blood pressure or blunt compensatory responses. That's why any new symptom after a medication change deserves prompt review, but never stop or adjust doses without your clinician's direction. Cardiac causes. Heart rhythm disturbances, arrhythmias, heart valve problems, and heart muscle dysfunction can all impair the heart's ability to pump enough blood. When cardiac output falls, blood pressure falls, and organs suffer. Autonomic dysfunction and neurological causes. Conditions that damage the autonomic nervous system, including Parkinson's disease, diabetic autonomic neuropathy, and certain spinal cord disorders, interfere with the reflexes that keep blood pressure steady during position changes. Endocrine and metabolic contributors. Low blood sugar, adrenal insufficiency, and thyroid problems can present with low blood pressure and should be considered, particularly when other symptoms suggest these systems may be involved. Frailty and decreased baroreceptor sensitivity. The baroreceptors, sensors in the neck and chest that detect changes in blood pressure, lose sensitivity with age. That blunted response explains why an older adult may not feel the immediate compensatory heartbeat increase that a younger person would, and why they tolerate hypotension less well. What to watch for in the history you'll give a clinician. When you call a clinician or emergency services, clear, specific details help triage quickly. Note whether symptoms began suddenly or gradually, any recent medication changes or missed doses, recent illnesses with vomiting or diarrhea, decreased fluid intake, presence of fever, new chest pain or palpitations, falls or injuries, and whether symptoms occur with position change or at particular times of day, after a meal, with exertion, when standing up. Timestamps are useful. How long did symptoms last? Did they recover quickly when lying flat? These concrete facts help clinicians know how urgent the situation may be. Next, we'll move into the second half of the list, the signs that often represent a more advanced decline in perfusion: breathlessness and rapid shallow breathing, reduced urine output, positional headaches and neck pain that suggest cerebral hypoperfusion, nausea and vomiting that worsen dehydration, palpitations and arrhythmias that can cause sudden drops, cold, discolored extremities and delayed capillary refill, and finally, the cluster of findings that indicate shock or multi-organ dysfunction. These are the signs that often prompt emergency services, and staying alert to them can make the difference between a quick clinic visit and an urgent life-saving intervention. 8. Rapid shallow breathing or breathlessness. What you'll see? The older adult appears to be breathing faster than usual but with shallow breaths, or they complain of shortness of breath, I can't catch my breath, even when at rest. You might notice chest tightness, use of neck muscles, or anxiety that accompanies the breathing change. Why it happens? Low blood pressure reduces overall oxygen delivery. The lungs and heart try to compensate. If the circulation can't keep up, tissues sense low oxygen and the respiratory center increases the breathing rate in an attempt to bring in more oxygen. Shallow, rapid breaths may also happen when the heart itself is struggling or when fluid builds up in the lungs because the heart can't pump effectively. Red flag cues: new or worsening breathlessness, especially if it appears suddenly, comes with chest pain, fainting, confusion, severe palpitations, or blue-tinged lips or fingertips, is a medical emergency. Breathlessness during minimal effort or at rest in an older person who was previously stable should prompt immediate evaluation. If the person has known heart disease and develops sudden shortness of breath, do not delay. Immediate actions. Have the person sit upright if that eases breathing. Sitting slightly forward often helps. Keep them calm and encourage slow, measured breaths. Loosen tight clothing around the neck and chest. If you suspect low blood pressure is the cause, and the person is dizzy or faint, help them to a safe seated or semi-reclined position to prevent a fall. If they have severe shortness of breath, chest pain, fainting, or cyanosis, lips or nails turning bluish, call emergency services right away. Note any history of heart failure, recent medication changes, or fluid loss to report to responders. 9. Reduced urine output or dark concentrated urine, oliguria. What you'll see? A notable drop in the frequency of urination, smaller volume of urine when they do go, or urine that appears darker and more concentrated than usual. In a care setting, you may note a lower hourly output. At home, a senior who usually urinates several times in the day may go many hours without needing to. Why it happens? The kidneys require a steady blood flow to filter waste and produce urine. When blood pressure falls, the body shunts blood away from the kidneys to preserve flow to the brain and heart. Reduced renal perfusion lowers urine production and concentrates the urine. In older adults, especially those on diuretics or with chronic kidney disease, this can happen quickly when volume or pressure drops. Red flag cues: sharp reductions in urine output over hours, very dark urine that suggests severe concentration or dehydration, or the development of swelling with decreased urination are all worrying. If decreased urine output comes with dizziness, confusion, vomiting, or low blood pressure readings, treat as urgent. Kidney function can deteriorate rapidly when perfusion is poor. Immediate actions: encourage safe fluid intake if the person is alert and can swallow without risk of aspiration. Small sips of water or an oral rehydration option may help if dehydration is likely. If the person is vomiting, has difficulty swallowing, is confused, or you suspect severe dehydration or kidney injury, seek clinical evaluation immediately. Keep a simple log of urine frequency and color to tell the clinician. This is often one of the most useful objective pieces of information you can provide. 10. Neck, back, or positional headaches. What you'll see: headaches that come on when standing or sitting up, headaches that improve when the person lies flat, or neck and upper back pain that seems related to posture or sudden positional changes. The person may describe a pressure type or band-like pain, or a dull ache centered at the base of the skull. Why it happens? The brain is sensitive to changes in blood flow. Positional headaches can reflect transient underperfusion to parts of the brain or changes in cerebral spinal fluid dynamics that are unmasked when pressure dynamics shift. Cervical spine degenerative disease or muscle tension can compound the sensation, but new or positional headaches in an older adult should prompt evaluation because they may reflect cerebral vascular insufficiency. Red flag cues: headaches accompanied by visual changes, weakness, numbness, difficulty speaking, or sudden severe onset, worst headache of life, require immediate emergency assessment for possible stroke, bleeding, or other acute causes. Headaches that consistently come with standing and resolve when lying flat, especially when paired with other hypotension signs, indicate orthostatic insufficiency and should be evaluated soon. Immediate actions: have the person lie flat and observe whether the headache eases. Provide a quiet, dim environment and assess for other symptoms: vision changes, weakness, vomiting, or confusion. Note the timing, triggers, and whether this headache is new or different from previous headaches. If the headache is severe, sudden, or accompanied by neurologic symptoms, call emergency services. 11. Nausea or vomiting, especially after standing or meals. What you'll see? The person feels sick to their stomach, may vomit, and may report that symptoms are worse after getting up from bed or after a large meal. They may also complain of not feeling hungry and experiencing general malaise. Why it happens? The digestive system is sensitive to blood flow. When the body senses overall low pressure, it diverts blood away from the GI tract to preserve flow to the brain and heart, which can cause nausea. Vomiting then compounds the problem by causing fluid loss and electrolyte imbalance, creating a dangerous feedback loop in which dehydration lowers blood pressure further. Red flag cues. Persistent vomiting with reduced urine output, dizziness, fainting, or signs of dehydration is a clear red flag. If the person cannot keep fluids down and becomes dizzy or faint, arrange for immediate medical assessment. Also be alert if nausea emerges soon after starting a new medication. Immediate actions. Keep the person in a safe, comfortable position, lying on their side if vomiting is active to prevent aspiration. Offer small sips of clear fluids if tolerated and the person is alert. If vomiting is persistent, if they can't keep even small amounts down, or if you see signs of severe dehydration, little to no urine, dry mouth, sunken eyes, confusion, seek urgent medical attention. 12. Palpitations or irregular heartbeats. What you'll see? The person says their heart is racing, fluttering, or skipping beats. You might feel an irregular pulse when you check it. Sometimes palpitations are brief and self-limited, other times they are sustained. Why it happens? An irregular heartbeat or arrhythmia can cause sudden, large drops in cardiac output and blood pressure because the heart is not pumping effectively even if it's beating. Atrial fibrillation, ventricular arrhythmias, and other rhythm disturbances are more common with age and can produce syncope, breathlessness, or low urine output when they result in inadequate perfusion. Red flag cues. Palpitations with fainting, chest pain, severe shortness of breath, or confusion warrant emergency care. New sustained palpitations, especially in an older adult, should not be dismissed. If palpitations are accompanied by ongoing lightheadedness or hypotension, call emergency services. Immediate actions. If the person is conscious, help them sit or lie down and assess their pulse. If the rhythm is irregular or very fast and accompanied by severe symptoms, call emergency services. If they recover and symptoms are intermittent, document the timing, triggers, and associated symptoms for the clinician. Wearable monitors or a prompt ECG in clinic may be required. 13. Cold, discolored extremities and delayed capillary refill. What you'll see: fingers and toes that look pale, bluish, or mottled, hands and feet that feel cold, and when you press a fingertip, it takes longer than 2 seconds for the pink color to return. Why it happens? When blood pressure drops, the body restricts flow to the skin and extremities to preserve core organ perfusion. This vasoconstriction makes the limbs cold and can change their color. Capillary refill, a quick bedside test where you press a fingertip and time the color return, is an easy way to screen for peripheral perfusion. Red flag cues. Persistent cool, pale, or bluish extremities with capillary refill consistently longer than 2 seconds, especially when paired with low urine output, confusion, or fainting, are red flags for significant circulatory compromise. Progressive mottling or increasing coolness despite efforts to warm the person requires urgent attention. Immediate actions. Warm the person's core with blankets, keep them lying down, and avoid rubbing cold extremities vigorously. Perform a gentle capillary refill check and note the result. If prolonged refill is combined with other worrisome signs, dizziness, fainting, very low blood pressure, call emergency services. 14. Signs of shock or multi-organ dysfunction. What you'll see: a cluster of severe symptoms, very low or unmeasurable blood pressure, rapid, weak pulse, pale and clammy skin, confusion or decreased level of consciousness, very low urine output, and labored breathing. The person may be lethargic, difficult to rouse, or unresponsive. Why it happens? Shock is the state where the circulatory system cannot deliver enough oxygen and nutrients to the tissues to sustain normal cellular function. It can result from severe blood loss, massive infection, sepsis, severe dehydration, catastrophic cardiac events, or overwhelming endocrine crises. In seniors, shock can develop quickly and progress rapidly to organ failure. Red flag cues. The pattern itself: low BP, weak rapid pulse, cold clammy skin, marked confusion, and anuria, is an immediate emergency. Any seniors showing these signs should be treated as critically ill. Immediate actions. Call emergency services immediately. While waiting for help, lay the person flat if it's safe to do so, elevate their legs slightly if there is no concern for a spinal injury and it eases symptoms, keep them warm, and monitor breathing and responsiveness. Do not give anything by mouth if they are drowsy or vomiting. Document onset timing, recent illnesses, medication changes, and events leading up to the deterioration for first responders. Bringing the pieces together, common causes linked to these signs. We've listed each of the 14 warning signs and practical immediate responses. Now tie those signs back to the most frequent causes in seniors so caregivers know which details to emphasize when they call for help. Dehydration and volume loss are among the most common and reversible causes. Older adults may drink less, have reduced thirst, or lose fluids through vomiting or diarrhea. Diuretics and laxatives can magnify this effect. When volume drops, blood pressure falls, and many of the signs we described, dizziness, fainting, low urine output, concentrated urine, appear. Medications are another major contributor. Drugs used for blood pressure, heart disease, prostate enlargement, depression, Parkinson's disease, and bladder dysfunction can each lower blood pressure or blunt compensatory responses. Polypharmacy, taking multiple drugs, increases the chance of interactions that reduce pressure. If symptoms began after a new prescription or dose change, mention that to the clinician. Do not stop medications without medical advice. Cardiac causes include arrhythmias, heart failure, valvular problems, and acute coronary syndromes. When the heart cannot pump effectively, blood pressure drops and organs suffer. Symptoms such as palpitations, chest pain, sudden breathlessness, and fainting during exertion suggest a cardiac origin. Autonomic dysfunction, seen in Parkinson's disease, diabetic neuropathy, and other conditions affecting the nervous system, leads to poor regulation of blood pressure with position changes. A history of Parkinsonian symptoms, long-standing diabetes, or spinal cord disease can point clinicians toward this mechanism. Endocrine problems such as adrenal insufficiency, uncontrolled diabetes, and severe thyroid disease can affect blood pressure. Metabolic derangements, low blood sugar, or significant electrolyte abnormalities can also present with many overlapping symptoms. Infections and sepsis are particularly dangerous in seniors. An infection may cause low blood pressure, septic shock, and can present subtly in older adults, sometimes with confusion or a fall rather than fever. If an older person shows sudden behavioral change or deterioration, assume infection is a possible cause until proven otherwise. Safe, practical, at-home assessment steps for caregivers. These checks help you gather objective details to report to the clinician and keep the person safe while you seek help. They are quick, non-invasive, and useful. Position safety. If a senior feels lightheaded or weak, have them sit or lie down immediately. Preventing a fall is the first priority. Pulse check. Use the pads of your index and middle fingers on the inside of the wrist just below the base of the thumb. Count for 30 seconds and double the number if the rhythm is regular. Count a full minute if the rhythm seems irregular. Note rate, regularity, and strength. Capillary refill. Press the fingertip until it blanches and time the return of color. More than 2 seconds suggests reduced peripheral perfusion. Urine output. Track frequency and color. A rapid drop in output or very dark urine over a day or two is important information. Orthostatic, positional BP checks. If you have a reliable home cuff and know how to use it, measure blood pressure and pulse after the person has been lying down for 5 minutes, then again after standing for 1 minute and at 5 minutes. A drop in systolic pressure of 20 mmHg or diastolic of 10 mmHg within 2 to 5 minutes is considered orthostatic hypotension. If you don't have a cuff, note whether symptoms reliably occur with standing. Medication review and history. Note recent starts, stops, or dose changes, missed doses, and the full medication list, including over-the-counter drugs and supplements. These details are crucial to the clinician. Fluid intake and recent illnesses. Record the amount of fluid taken over the past 24 to 48 hours, episodes of vomiting or diarrhea, fevers, and whether appetite or oral intake has been poor. Timing and triggers. Note when symptoms began, how long they last, what triggers them, standing after meals with exertion, and what helps them recover, lying flat, drinking fluids. Photograph or write it down. If the person has visible signs, pale skin, discoloration of extremities, unusual bruising, take a clear photo and share it with a clinician if safe and appropriate. Remember, these checks help you give a clear, objective picture to clinicians. They do not replace professional assessment, and they're not meant to delay emergency care when red flags are present. What clinicians will usually do in the evaluation. On arrival at a clinic or emergency department, the care team will rapidly assess airway, breathing, and circulation, obtain vital signs, and start a focused history. Typical diagnostic steps include electrocardiogram (ECG) to look for arrhythmias, ischemia, or conduction problems. Cardiac rhythm disturbances are a common reversible cause of syncope and hypotension. Blood tests. Basic metabolic panel to check electrolytes and kidney function. Complete blood count for anemia or infection clues. Blood glucose. Markers of infection as indicated, and sometimes thyroid or adrenal testing if suspicion is high. Orthostatic measurements performed in a controlled setting to document position-related drops in pressure. Continuous cardiac monitoring, telemetry, or ambulatory monitoring if arrhythmia is suspected. Chest X-ray and, when indicated, echocardiography to evaluate heart function, valves, and possible pulmonary causes. Urinalysis and urine output measurement to assess kidney perfusion and dehydration. In some cases, if a neurologic cause is suspected, brain imaging or specialist testing may be ordered. For suspected autonomic dysfunction, referral to specialists and formal autonomic testing may be arranged. Broad management approaches the team may take. Management depends on the cause and severity. In emergency settings, stabilizing circulation and oxygenation comes first. Interventions might include intravenous fluids for volume depletion, oxygen if needed, and hospital monitoring. If an arrhythmia or cardiac issue is found, specific cardiac treatments or procedures may be necessary. For orthostatic hypotension related to medications, clinicians may adjust the regimen after careful review. Again, do not change drugs at home without provider guidance. Other non-invasive strategies commonly recommended include compression stockings to reduce blood pooling in the legs, counseling on slow positional changes, increasing dietary salt or fluid intake when appropriate, and physical countermaneuvers, crossing legs, tensing leg muscles before rising, taught by therapists in certain cases. Your clinician will tailor therapy to the underlying cause, balancing risks and benefits in the context of other medical conditions. When to call 911. Clear escalation rules. Call emergency services immediately if your loved one has any of the following: a fainting episode with injury, seizure-like activity, prolonged unconsciousness, or failure to regain alertness promptly, severe or worsening shortness of breath, especially with chest pain, cyanosis, or severe anxiety, confusion or decreased level of consciousness that prevents safe self-care, signs of shock, very low or unmeasurable blood pressure, very weak rapid pulse, pale and clammy skin, minimal or no urine output, sudden new focal neurologic deficits, weakness of one side, slurred speech, visual loss, treat as possible stroke, any unstable cardiac symptoms, chest pain, sustained palpitations with syncope, or signs of heart attack. Call your clinician or seek urgent clinic assessment when symptoms are new or worsening but not immediately life-threatening, recurring dizziness with falls, ongoing palpitations without collapse, persistent reduced urine output without severe confusion, or unexplained fatigue coupled with drop in blood pressure readings at home. Symptoms started after a medication change and the person is stable but needs a medication review. You have objective evidence of orthostatic hypotension at home and want guidance on next steps. If in doubt, err on the side of safety. If the person seems significantly worse than usual, has recurrent falls, or you are worried they could deteriorate, calling emergency services is appropriate. Communicating with clinicians what to say and what to bring. When you call ahead or arrive at care, be concise and factual. Useful things to report include exact description of symptoms, timing, and triggers, e.g., sudden dizziness on standing from bed 3 times this morning, lasted about a minute each time, 1 episode with fainting that caused a minor head bump. Vital signs if available, home blood pressure and pulse readings, lying and standing measurements if taken. Fluid intake, urine output, vomiting or diarrhea episodes in the last 48 hours. Recent medication changes, hospitalizations, or new prescriptions. Known medical history, heart disease, diabetes, Parkinson's, kidney disease. If possible, bring a current medication list, a photo of the person's medications, or the bottles themselves. Case vignette to illustrate the difference early action can make. Mrs. L, an 82-year-old who lives with her daughter, started feeling lightheaded after lunch and sat down. Over 2 weeks, she became more tired and occasionally complained that her vision went fuzzy when rising from her recliner. One morning, she fainted in the bathroom and fractured her wrist. At the emergency department, a careful history revealed she had been on a higher dose of a diuretic for several weeks and had had a bout of diarrhea 3 days prior. The ED team gave fluids, adjusted her medication plan in consultation with her cardiologist, and arranged close outpatient follow-up with a nurse and physical therapist to reduce fall risk. With those steps, Mrs. L's episode stopped. Early recognition and clear communication with clinicians prevented further injury and preserved her independence. This is the kind of real-world chain you want to avoid. Small symptoms that are dismissed, followed by a fall or more serious collapse. Your attention as a caregiver can interrupt that progression. Prevention and practical daily strategies for caregivers. Prevention focuses on risk reduction and early recognition. Some practical steps: encourage regular, adequate fluid intake, especially during hot weather or when ill. Help seniors rise slowly from lying or seated positions. Pause at the edge of the bed or chair, sit for a moment, then stand. Keep an updated medication list and review it annually or after any hospitalization. Ask clinicians about medications that can affect blood pressure and whether timing or dosing adjustments could reduce symptoms. Do this with the clinician's guidance. Do not stop medications on your own. Reduce fall hazards in the home. Good lighting, clear pathways, grab bars in the bathroom, non-slip mats, and proper footwear. Maintain a schedule for monitoring weight, fluid intake, and urine output if frailty or fluid shifts are a concern. Encourage moderate, supervised physical activity as tolerated. This can improve vascular tone and orthostatic tolerance for some people. Consider compression stockings for those with significant pooling in the legs, but discuss with the clinician first to ensure they're appropriate. A final note about the 8 seconds and statistics. Some research reviews and observational studies summarized in sources like NCBI and in clinical discussions note that in certain situations, a critical drop in cardiac output can lead to loss of consciousness in as little as roughly 8 seconds in some patients. Use such figures as a reminder of how rapidly severe circulatory collapse can happen in selected scenarios. They are not universal timing for every patient. Likewise, prevalence figures reported in the literature vary by population and study design. Some studies highlight high rates of unrecognized blood pressure drops among older adults. Trusted institutions such as the Mayo Clinic and Cleveland Clinic emphasize vigilance. Orthostatic hypotension and symptomatic hypotension are common in seniors and deserve thoughtful evaluation. Recap the essentials to remember right now. Low blood pressure in older adults is not merely part of getting old. It can be a sign of dehydration, medication effects, heart problems, neurological disease, or infection, and it can progress quickly to organ injury. The 14 alarming symptoms we covered are the specific signs caregivers must not overlook, from dizziness and fainting to breathlessness, reduced urine, positional headaches, palpitations, cold extremities, and the cluster of findings that indicate shock. Act early. Sit or lie the person down, prevent falls, gather objective details, pulse, capillary refill, urine output, positional BP if available, and get medical help when red flags are present. Final practical checklist you can screenshot or save. If dizzy, sit, lie down immediately, prevent falls. Check pulse and capillary refill, note urine output. If symptoms are new, severe, recurrent, or accompanied by chest pain, severe breathlessness, focal weakness, or decreased consciousness, call 911. For new or worrying but not immediately life-threatening symptoms, contact clinician for urgent assessment. Keep a medication list and report any recent changes. If this video helped you, share it with a parent, grandparent, or caregiver who needs to know these warning signs. And subscribe so you don't miss more essential guides on elder health. Remember, early recognition and clear communication with clinicians can prevent injury and save lives. This information is educational and not a substitute for professional medical advice. When in doubt, seek urgent medical evaluation.